Hello and welcome to On the Record. I'm your host, Jerome Sawyer. We're so glad you could join us tonight. With COVID-19 numbers steadily increasing, we will hit 3,000 confirmed cases before we know it. But what's changing? Are we learning to finally live with COVID? Tonight, we talk about the realities of living with COVID-19. Stay with us.
So the project really pays itself back.
Correct.
They set up
At the conference, the school.
As a journalist, I always have to focus on the facts, and sometimes that means going to investigate for myself. On the Record, Thursdays at 8 p.m. right here on RTV.
And welcome back. You're watching On the Record, the realities of living with COVID-19. Over the past week, we've seen recovered cases increase by over 200, a remarkable improvement that can sometimes be overshadowed by the over 200 increase in cases. And with borders about to reopen and restrictions lessened, it sure adds some light to the end of the tunnel. However, that does not mean that we are out of the woods just yet. Here to help us expound on the true realities of COVID-19 within the healthcare system, staff, and its medical effects on our citizenry is President of the Consultant Physicians Association, Dr.Sabriquet Pinder-Butler. Dr. Pinder-Butler, welcome back to On the Record. It's good to have you with us again.
Thank you for having me, Jerome.
So much has changed since we would have spoken, I guess, months ago now. We would have seen a tapering off of numbers. We would have seen the second wave. But I thought it important to do the show this week because of something that I have sensed, I guess, within the community. It seems as if we are coming to terms with this new reality, particularly on the healthcare side. It seems as though we are not as anxious. It doesn't seem to be the same fervor that we had weeks and months ago when we were at the height of all of this. And I just want to begin by asking you, have you noticed for us as a community that our response is different, our approach is different? It seems to me, where I sit, that things are different.
So absolutely, things have been different from the start of the pandemic up to this point. Our response as a healthcare team certainly has been somewhat different in that we have certainly come to terms with the fact that we will be dealing with COVID-19 for a while. And of course, we all know that that time period is yet to be determined. And so we continue to do our best to follow the safety protocols that we can follow to make sure that our healthcare workers are as safe as can be. Having said that, we also know that our numbers have certainly increased significantly. I think we're over 2,000 and almost up to 3,000 now, and we have community spread in country. And so even though we may not be as frantic, perhaps, or as timid as we may have been in the first instance, we are still cautious, and we still also would like to ensure that our Bahamian population also understand that although we're reopening, we cannot become lax with the safety measures, ensuring that we wear our masks, social distance, wash our hands, and protect each other as best as we can from contracting COVID-19.
One of the biggest differences has been the spread throughout the islands, the family islands. I mean, as far south as Crooked Island and Maguana, islands that were thought to be safe communities, that were thought to have been safe, are now dealing with it. What has the impact been as we now consider those islands, those communities, those people who are affected, that in many instances don't have the same level of care and access that we have in the larger, more populated islands?
So, absolutely, Jerome, that has occurred. And this would have been one of the concerns of the CPSA when we initially reopened, because we knew that we had limited spread to a smaller number of islands, predominantly New Providence and Grand Bahama. And certainly, when we now realize that we have many different islands that are battling a virus that we cannot see, and we know that our healthcare system is already stretched. And in certain instances, we cannot reproduce the same level of healthcare on those islands. And there may also be challenges in terms of timeliness with getting persons to Nassau, where the help may be needed, especially for persons who need to be hospitalized. That is concerning because we know that we do have about 2% rate of death that we've seen so far by COVID-19. And we know that it has significant, serious potential for impacts on our elderly population. And certainly, I think most of us know too that a lot of our elderly population still reside on those islands that you mentioned. So we are certainly concerned about this.
You mentioned the 2% death rate. Now, from a statistician perspective, from a numbers perspective, that would seem small. But in our community, what does that say? And what does that 2% say given the number of cases that we have when we're almost peaking at 3,000?
So certainly, it says a lot, and we hope that the numbers actually don't turn out to truly be reflective of our population numbers, because even 10% of 400,000 is significant, and 2% certainly is as well. And we're already at 60 plus deaths. And we know that this pandemic is said to be here with us for perhaps into next year. We hope not beyond that. Hopefully, if there's a vaccine or we're able to limit the spread. But certainly, the numbers are significant when we're talking about a small country like ours. That is significant.
Now, in one of your recent press releases on behalf of the Consultant Physician Staff Association, you indicated that it's been 7 months now of our battle with COVID, and that this pandemic will not be coming to an end soon, which you again just recently reiterated. Do you believe that our population, though, understands that COVID is still very real and hasn't gone anywhere?
I think that is one of the fears that we are having as healthcare professionals, because we still see persons in the community, and even as we speak to people who call our healthcare facilities and who speak to us on a daily basis, they're still in denial of having COVID symptoms. Even some persons who receive a positive test result, especially if they are asymptomatic, and even some who've had symptoms, still deny that they have COVID-19. And that is a very scary thing, because certainly, the first thing that aids with treatment and allowing prevention in the first instances is to actually accept that we have a problem or that a condition actually exists. Because if you don't accept it, just like our diabetics and hypertensives, perhaps, who don't accept that they have these conditions, then the things that we advise to help them, they're not going to do. And so we still see a significant amount of persons who are, maybe they're in misbelief that it's there. Maybe they feel that going to be in the 80% who will not have many symptoms, and so they're not as concerned. But certainly we're concerned about that, 15% that may not do so well, and the 5% or 2% that may die. That's significant. It's very real. Our hospitals are full. We have had to open additional spaces. That has been spoken about by the Ministry of Health. So certainly we would not have needed to do those things, and to have to deploy our staff in clinics as well as hospitals to other areas to assist if this situation was certainly not something that is very, very critical in this country at this time.
I want to talk about the progress that we may or may not have been making, but I'm always concerned about the messaging. And it's interesting you said there are a lot of people who may be out there experiencing symptoms or that they know that they're positive and certainly have, for whatever reason, not gotten tested, don't want to get tested, continuing life as normal. Have we done enough to push the message that if you are not well, if you are unwell, if you have symptoms, to get tested? Or have we just placed too much emphasis on wash your hands, wear your mask, sanitize, which is important, don't get me wrong, but have we
Right.
not expanded the messaging enough?
I think that we could have done a better job overall with pushing that message. Certainly, we know that sometimes you think that because people watch TV or read the news and see these things happening that it has meaning. And it may not. It may not because if you don't feel pain yourself, sometimes even though a scratch may be there, you tend to ignore it. That's what we do as a people. So we understand that. And that's why we think it's important for us, especially at this time, especially when we see the community spread. We see that so many things are reopening. We know that inter-island travel is happening, and in some instances, persons may not be required to have testing or have to quarantine. And as you said, COVID is on all of the islands, and so that is also concerning. But we need to make sure that persons understand that there's no stigma with COVID. If you have COVID, it's nothing wrong. It's a virus like the flu, and in a lot of instances you did nothing to pick it up. It just happened. So don't feel ashamed or want to hide it, and definitely don't not take it as serious as it should be, even if you have mild symptoms or no symptoms, to potentially pass it on to others in our community who may not do as well as you. And that, I think, is happening. So yes, we need to certainly push that message along more now than ever, Jerome.
Well, Doc, it's funny, it's not even funny, it's interesting you should say that. I was going to save this for a little later, but I can report to you that I tested positive this week myself. And that's after feeling ill for some time and deciding to quarantine myself at home, and then eventually getting tested. I tested positive on Tuesday of this week,
Okay.
and now I'm at home, feeling very good. I think the worst is behind me, and I think once you said that, that told me that I needed to make my announcement, and this is the time to do it. But many aren't like me, Doc. There are
No.
people out there who are feeling ill, may be positive, and continuing life as normal. What do you say to those people?
So I am glad that you shared that, Jerome, and I am also glad that you are doing well, because I think it's important for people to understand that. I think you've done the best thing by quarantining and continuing to take care of yourself and to protect your colleagues, your family members, and the other persons in our population. um, you know, Persons who intentionally do it and give it no thought, I really think that you need to think about it. I don't know if it is that some persons really aren't thinking about it or they just don't care. I would like to think that we haven't become an uncaring society, because if we have, we should be ashamed of ourselves related to that. And so I want to think that it's because, and hope that it's because we really don't understand the true serious effects that this can have on ourselves, and if not ourselves and our families, on other people. Because that's really what the sad part is. If you go and you give it to someone who doesn't know, that elderly person in the convenience store who has no clue, or someone at the pharmacy who's trying to help you, those things. Or even if you pass it to your children and they're now going to school, to the teachers, it is very serious. And I can tell you, almost on a daily basis, I have to urge people to stay home. I have to urge them and call surveillance and all of these things, things that we expect our people to do. they're just not wanting to do those things. So I'm glad that you shared so that others can understand it's there's no shame in having COVID. There's absolutely no shame in having COVID at all.
And you go through a period of denial. I mean, I did what I
Yes.
thought was the right thing immediately, almost 14 days ago now in quarantine. But there was a period where I thought to myself, these symptoms are related to something else. I'm plagued with
Yes.
sinus. I had spoken to my doctor. He said, well, let's, stay in. Let's see how it goes. But you do go through a period of denial. You do go through a period of fear, wondering how this is going to affect the people that you may have been in contact with. And
Mhm.
you think, well, let me give it a couple of days and see what happens. And I want to talk to you about why people should immediately, isolate, quarantine, cut yourself off at the first sign of trouble.
So you're absolutely correct. A lot of patients initially go into denial, and this is why too. I think I always try to liken it to what happens with a lot of other conditions when you tell persons that they have medical conditions. So we see it a lot. Most persons deny, and so it's not a surprise that that has happened. But it's good when you come to the realization that there's still a strong potential, and especially with what's happening in country that the likelihood of you having COVID is very high at this time. And that is why it's extremely important that if you have any symptoms that you stay home and you try to quarantine right away. Because the more persons that you come in contact with during that period means that those persons may also be potentially at risk. And so then even the contact tracing becomes potentially overwhelming, making sure those persons, because now they're unaware and they've gone home to their families, they've gone to the grocery store, they've gone to everywhere that's reopened, church, everywhere, and they don't know. And so 3 days later, or 5 days later, or even a week to 10 days later, if they now know that they have come in contact with you now have to go back and track all of those persons from that week before, and then heaven forbid for the persons that aren't telling other people, because that's really the scary part. There are a lot of people that are not telling people they have tested positive. They're not giving names for contact tracing, and so a lot of persons are unaware.
Um, I want to know too, from a medical perspective, we would have heard, announcements from the Prime Minister and just recently the Minister of Tourism about reopening, specifically reopening our borders once again. Not that they have officially closed, but doing some things to reopen hotels, etc. But from a medical perspective, are we, in your opinion, are we ready for that?
I think at this point in time, we appreciate that the economy needs some reopening. We have not argued that. We have had different debates, even among our consultant group, as to how that should happen, the timeliness, etc. I think we've agreed that, once those things are coming into play, there should be proper training for the staff that are going to be involved in all of those industries. Certainly, I know that the trade union today actually launched a training program that was also endorsed by the government, specifically related to that. And so I hope that that continues. But it is extremely important. Persons at the aviation, from the airport, taxi drivers, the straw vendors, everyone. I think this is the time now, while we are talking about reopening, hotel workers, to make sure that they're aware of, essentials of how COVID is transmitted, what they should do if someone is exposed, what to do, because a lot of times too, we have persons calling after a potential exposure. There's no plan in place, and so, if no plan is in place and something happens, and it's likely to happen, just given the fact of what we've been dealing with, they need to be prepared. Would we have liked things to have been done differently? Sure. The borders perhaps may not have needed to be reopened so soon, but it has happened. So now we have to deal with things moving forward. And so I think we just need to be systematic with what we do to be able to ensure the safety of our guests, of our residents in the Bahamas, extremely important. And we have to, because it also boils down to the healthcare system, because once persons become ill, we have to take care of them. And if we are continue to become overwhelmed with the numbers of cases, we're not able to provide the care that is needed for those persons. And that's also a concern.
Very quickly, and we've got to just take a break now. Are you satisfied with the current guidelines that are in place for individuals who are having to travel?
So at this point in time, I mean, I think that one of the concerns, as we spoke to, was that we have COVID in so many different islands. Certainly, from what we've seen that's been put in place from an international standpoint, I think at this moment that is acceptable. But when we look at what's happening related to inter-island travel, and with us having cases throughout the islands, perhaps we need to revisit that, because again, we don't want to have large numbers of cases happening on Mayaguana or Crooked Island and other places, because now persons are not testing and they're going through different stops. And then we're further exposing those residents there. I think we have to be a little bit cautious when we do that. And I think it's starting, is it today or soon that's happening? I'm very concerned that we may see numbers starting to rise again. Certainly we talk a lot about enforcing things in this country. Yes, it's one thing to have the emergency orders and have fines, but we need to make sure that those things are enforced, because if they're not enforced, it's almost as if we haven't enacted what we've tried to do. And that is something that we've also seen happen as well.
Doc, thank you much. Don't go anywhere. We're going to take a break. Our discussion continues, the realities of living with COVID-19. Don't go anywhere.
Our stories.
To shake up the Minister administration.
Eye on Tropical Storm Dorian.
Our tragedies.
Going out and wipe this place down like that. New national record setting time.
Our triumphs.
Contest champion Money Hill.
Our culture.
Welcome to Our News, and thank you for joining us.
Our news.
You're watching On the Record. I'm your host, Jerome Sawyer, and this segment is brought to you by Executive Printers. While for some, the COVID pandemic has been a work-from-home vacation or time off from work for those furloughed, but for healthcare workers, it has been quite the opposite. These workers have not had a chance to take a break or rest, unfortunately. My guest, Dr. Sabriquet Pinder-Butler, is a family medicine consultant and president of the Consultant Physicians Association. Again, thanks for being with us. Thanks for continuing to be on the show and certainly to provide some engaging information. Now, in terms of testing, that's what I want to talk about now. There's been a lot said about testing. Do you believe the number of confirmed and active cases are a true reflection of how many Bahamians are currently living with COVID?
So I think the numbers perhaps reflect the persons that actually get tested, even though there's still a delay. And there has been improvement with that. So that has been a good thing. But there are a lot more persons who are not getting tested. And so certainly I think the numbers are definitely higher than what is reflected on the dashboard.
In terms of testing, I want to talk about those who, and we mentioned it earlier, those who refuse to get tested. What should employers be looking out for? Because the reality is, a lot of people are holding on to their jobs. Not a lot of people are without jobs, and those of us who are still working are obviously very keen on keeping our jobs. And you may think, hey, I'm going to go into work. You know, as an employer, what should you be looking out for within your employees?
Well, certainly, I mean, as an employer, you want to reinforce and educate again your employees as it relates to not coming to work when they're sick. I understand, the importance of persons securing their jobs, but right now that is also extremely important. However, certain things that are related to symptoms of COVID, like, muscle aches, a cough, a fever, and then some of those things may not be present. Persons may just feel extremely tired, may have diarrhea, even red eye, pink eye, that we call it. So the challenges as it relates to COVID now in particular, because some of the symptoms are so non-specific, it's a challenge for the employer per se to look out for what might be specific related to COVID. And so one of the main things we want to encourage employers is to understand, especially at this time, if someone is not feeling well, it is best for them, as well as your other employees who can potentially become ill, to try to stay home until they're certain as to what is happening with them.
I want to talk about this whole issue of once you have been positive and then you are given the clearance. Now, from my perspective, I've been in quarantine just about 14 days now, self-quarantine, but I tested several days ago, and when that positive test came back, I received a call from the Ministry of Health. They said to me they will call me every day for the next 10 days to check on my symptoms, and at the end of those 10 days, if I am not if I don't have any symptoms, I will be released. And when I questioned, they said this is according to international standards. This is the standard that's being put in place. Could you talk us through that a bit and tell us, what that's making some people nervous. But they did also tell me that, if I'd like to get a test at the end of that period, I may, go get a test. And if that test is negative, I can return to work or return back into the community. If it's not, then, I go back to another 7 to 10 days of them, keeping me under surveillance. But, I want to talk about how we put that into context for everybody. If you're in and you haven't had symptoms at the end of that period, are you okay to return back to work or return to your family or return to the community?
So yes, the Ministry of Health did update its timelines with when persons should return to work and when persons are allowed to come out of quarantine, and the timeliness with testing and not having to be retested. Those guidelines, I think, were put in place internationally a few weeks ago. We were a bit delayed with implementing them in country, I think, because as you're questioning now, there have been questions simply because, coronavirus and COVID-19 is a novel or new disease. And so there are a lot of things that we're still learning. So the thought behind that, from my understanding, is that because a lot of studies that they've looked at have shown that persons are no longer contagious after that time period, that is generally why persons do not need to be retested. There are certain caveats, of course, if someone works in healthcare or depending on if they've been hospitalized and things along that line, because again, for healthcare workers and other essential workers, they're again engaging with a totally different population, immunocompromised and that sort of thing, people who are ill. But certainly in the general population, from what we've seen overall, persons are, even though they may still test positive, perhaps, because that has been something that has come up. Someone may test positive. It might be linked to dead virus and different things, but they're not thought to be contagious. But again, having said that, of course, we know that this is, a fluid situation. I'm sure that if things change, we will be watching out to see what occurs. But certainly the guidelines internationally have changed in that regard.
Two things after that. Now, do you advise that, at the end of that 10-day period that if you're able to, that you still get tested? And once you've contracted COVID and you've built up these antibodies, so to speak, are you now safe for the next few months?
So I think that the research that is out there hasn't really said that they can prove how long immunity lasts with the antibodies for COVID. That's been the challenge. So, there have been some studies that have looked at some persons, even though the numbers might have been low, that they thought might have been reinfected and things along that line. So we can't really say yet how that immunity will work. And that is why we're still asking persons who would have contracted COVID and recovered to also do not feel that you will be COVID free forever. That's not how it works. I mean, it's similar to the flu. You can get the flu again, it's a virus. So we want to make sure, stress that. I'm glad you asked that, Jerome, because I think a lot of people feel too. I actually saw someone yesterday who said to me, well, I had it and I'm good now. So I could take on anything. And I said, no, 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 do not feel that way, because you don't want another bout of something that you made it through this time. And we still don't know enough to be able to say that. What I say to persons, I support evidence-based medicine. And so certainly I think that the standards that are set now by the ministry and internationally are supported. But I do advise persons who are not comforted in that, because you still have to be mentally comfortable if you want to be sure for your own safety, and for persons that you work with or your family members and you're able and you want to be retested, you should go ahead and do so as well.
Want to talk now about a little bit about going forward. Based on what is to happen in the next few weeks and months, are we equipped as a country within our healthcare system with the amount of beds? Do we have enough beds, PPEs? Are these things, have they been adequately addressed? Do you think we have what we need going forward?
I think that is a complex question, and I will answer what I think would be the simplest part at this moment. At this moment, as it relates to the PPEs, we haven't had many challenges with getting sufficient of them that are needed appropriately at this time. We hope that remains the case. Certainly, we know that when your COVID cases or your numbers become even higher, it can become a challenge, and especially if it's seen to happen on a global scale, as it has happened before in the past, it can become a challenge. So it's always something that's in the back of our minds. But at this moment, we're generally doing okay with our PPE supply and have been assured by the Ministry of Health as well as other healthcare managers that is not a challenge at this moment. Certainly, we know that space in the hospital, bed space in general for COVID patients as well as for non-COVID patients, has been a challenge. The ministry has made some efforts to secure additional spaces. I'm sure that more space is required, more staff is required. Certainly, that's one of the reasons too why we think it's extremely important as healthcare providers, and from the CPSA's standpoint, it's important for us to continue to encourage all persons in the Commonwealth of the Bahamas at this time to please do your best to try to stay safe related to COVID and even non-COVID medical conditions at this time, because we do have challenges in those regards, and it's going to take time for those things to be corrected. And so we hope that we will get the necessary beds, we'll get the necessary support staff to do what is necessary as we deal with this pandemic.
The Minister of Health would have just announced in the House of Assembly that he would have announced this week that we are looking to recruit additional nurses, whether they are nursing students or nurses from abroad. Is that what we need at this point? And I wanted to go a little further. Do we need more doctors, more healthcare professionals in other areas as well?
So I think a few months ago, we would have talked about staff burnout, physician burnout, nursing burnout. Even before COVID, we know that we had shortages with nursing staff. We've had shortages with physician staff. And so we are happy that there has been a commitment to look into getting more assistance. Certainly, it is needed. In all of those areas, persons are working overtime, trying to make things happen as best as they can. They also have families. A lot of them have children who are now home or getting ready to go back to school. That also poses a challenge because they are overwhelmed at work. And, we think it's extremely important for us to get the support that is needed. So, certainly, if we're able to get qualified, trained healthcare professionals to help our system, I think that that would be helpful. It would allow for us to perhaps have the staff complement to allow for physicians and nurses to work the appropriate hours that are needed, especially when we look at those that may have to be in quarantine, because that also depletes the manpower needs and the numbers of persons that are in departments, and we're seeing those shortages even now. So that is absolutely necessary. And certainly we look to even the hiring of those physicians that were not hired, some of our junior doctors. So we
Yes.
await their start because that's absolutely important. We already have persons in country who are ready to go. So let's get them
Any,
back.
yeah, I'm glad you brought that up. Any indication that they will be hired and brought on staff anytime soon?
So we were advised that they would be hired and that the government did commit to that. And so I would like to encourage the government and PHA to try to move a little faster so we could now get them in. We know that, sometimes government moves a little bit slow. This is a pandemic, so we need you to get them in. We need you to get them in quickly.
We've talked a little bit about the physical impact of this on the healthcare workers. I want to know what's been the emotional impact. I know some healthcare workers have been away from their families. You see your own colleagues, I'm sure, falling ill. Unfortunately, in some cases, we've had people pass away. And then there's just the strain of it. Every single day you're faced with it, the fear of it. And talking to my own physician, he talks about every day just dodging the bullet. What
Yes.
is it like emotionally, for people who work in this industry?
I think emotionally it is a challenge because you are working in an environment that is now unsafe, perhaps in a lot of instances. And so every day before you walk into the institution, you say a prayer and you automatically become extra guarded by what you're doing with patients, with your coworkers, because the dynamics have changed. You are hoping that at the end of the day, after doing your best to take care of those persons that need your help, that you're able to go home and be safe because now you're with your family. And, I think a lot of the emotional distress that actually is borne by physicians and the healthcare team has to do with exactly that. Now, trying to protect your family who, is at home and not in this environment. And, certainly, even when physicians and other healthcare workers do become positive, it's stressful because their concern is not just on them, it's for their family members, husbands, wives, children, mothers, brothers, everybody, as you can imagine. And then we're also in the community, we have had family members that have had COVID as well. Some have not made it, some have died, some have been in hospital very ill. And so we're also dealing with that as well. So it is quite a stressful time. We try to encourage each other daily. We try to encourage it within departments, encouraging let us know, check on each other, make sure you're taking your vitamins, make sure you try to get as much rest as possible, stay hydrated. and tap in if you need to talk to someone, because sometimes all of us need a little support. So we appreciate that. Right now an extremely stressful time emotionally, but we rely on our inner strength. We rely on our resilience as a people, and we rely on our strength in God to help us as we go through each day.
Doc, we're going to take another break in the show, but you're so right. In the beginning of this pandemic, we were every day reminding our healthcare workers what they meant to us, those on the front line. But I think even with that, we've become complacent and started to take it for granted that you all are going to continue to be there. But I'm happy you brought that up, and I want to encourage folks to continue to support you all in the work that you do and provide that emotional support that you need, because that is so very important. We certainly could not have made the strides that we have made without you. And so, I do want to encourage people to continue to support and look out and send an encouraging word to everyone out there who's on the front line every day. So thank you, but don't go anywhere. Don't go anywhere. We're going to take a quick break in the show, and our discussion will continue right after this.
So the project really pays itself back.
Correct.
They set up
At the conference, the school.
As a journalist, I always have to focus on the facts, and sometimes that means going to investigate for myself. On the Record, Thursdays at 8 p.m. right here on RTV.
Welcome back. You're watching On the Record. Tonight we cover the realities of living with COVID-19. I'm your host, Jerome Sawyer, and this segment is being brought to you by the Grand Bahama Power Company. My guest is a family medicine consultant and president of the Consultant Physician Association, Dr.Sabriquet Pinder-Butler. Thank you again for being with us. On September 1st, the Consultant Physician Staff Association would have sent a list of recommendations to the Minister of Health. One of them was that the union association leads managers should be involved with decisions related to the COVID-19 task force and be able to brief healthcare teams prior to nationwide announcements so that things can be properly implemented and meaningful practical guidance can be given. Why was it necessary for you to send that note, and has that been happening since?
So throughout the course of this pandemic, we would have had engagement with the Ministry of Health and others at different levels. Initially or earlier on in the pandemic, our engagement with the then Minister of Health and the ministry was more frequent, and we participated in a lot more hands-on type of, encounters that allowed us to provide direct advice related to health matters and matters in the country, which we thought were important because we work in the healthcare system, we're in the community. A lot of us are on the ground with patients day to day. And so, sometimes from a management perspective, you might want to implement things without necessarily considering all the dots that are needed and all of the players. And so we thought that was important. So that was happening. But then as we had a change, there was some shifting. We have seen and have had some more engagement to date, because we had that request some months ago, and we continue to make that request. We still think that better engagement can occur at that level. It's difficult for us as the persons at the hospitals and at the clinics and on the ground level to learn of things that may subsequently be corrected later on in the week, because we did not think about, the full ramifications of how things may affect healthcare in general and our patients. And we feel that because we are, the experts in the field, we work with the team, and a lot of us are in touch with our patients and other persons on the ground, that we could give the best advice to the Ministry of Health, to make sure that we make this COVID pandemic work as best as it can in country. Because at the end of the day, we're about trying to save lives and help our people in the country. And whatever is needed to make that happen, we've always offered our support to do that, and we continue to do the same.
Your association called for the decentralization of testing to include private offices and local labs with proper protocols being established. I know that has happened because my testing was done through a private facility. But why was that so important, and how has that sort of impacted our ability to get the numbers and to get a handle and to understand what's happening?
So we thought that was extremely important because I think, as you could appreciate, Jerome, and others in the country, we had a serious backlog with our cases and with persons being able to access testing. And so we thought that it was extremely important, especially with the increase, the exponential surge that we saw, that we allow other private labs to get on board, other than doctors. Other labs have been coming on board. We've even seen in other countries that that is what has been employed to help people get the testing. The experts globally speak to testing and more testing so that you can know what's happening in country and allow people to even participate in further reopening of countries and visiting other countries, because people conduct business all the time. And so
Right.
you should be able to get test results in an adequate time, not wait 10 days, have options. Not everybody wants to go to South Beach Clinic or want to go to PMH. So we thought that was extremely important, and even looking at further decentralizing that to private offices who may decide that they wish to do it once they're qualified and certified and engaged with the Ministry of Health, and the Ministry of Health has protocols in place. There should be no reason why that should not be able to happen.
My experience was very good and very professional, and turnaround time was excellent. I also want to talk a little bit about something that has arisen within the healthcare system, and I don't know if it's directly related to what's happening with COVID, but there's been a lot of reports lately about situation at the maternity ward, the labor ward at PMH, and the criticism that has come about. And I wonder, whether, this is a result of that, or this is something systemic, that people are just coming forward to discuss it. And I guess in a larger context, when we're dealing with something like this, how is that going to impact the overall healthcare system and delivery of health in other areas with something seemingly as basic as going in for the delivery of a baby?
Yes. So certainly, we know that a lot of things have been talked about, social media and TV, etc., related to persons not being able to receive care as they perhaps ought, as alleged, or being able to receive, care in a timely fashion. And I will say that, this too was one of the concerns when we talked and looked at some of the effects potentially of COVID-19 on healthcare in general. I think the international organizations have been talking about that from maybe 5 or 6 months ago. And this was always one of the concerns, with trying to make sure you contain the spread. And one of the reasons why in the first surge, we were trying to get that word out, because once your healthcare system has become, overfilled or full to capacity potentially with COVID cases, and you have exposures to the healthcare team and all of those things, it can cripple in some sense the care that you would like to provide at its highest standard, because certainly things not be able to quickly as we would like that to happen, because instead of having 5 persons available, you may only have one. Sometimes hospital rooms may be full because patients are sick. They're sick from COVID, and now they're also sick from other healthcare things, because in the first wave, too, we were trying to make sure that persons who did not need to come to hospital and clinics didn't come because we didn't want them to pick up COVID. And so now they're coming, and we weren't able to have what we call those elective or non-emergency procedures, and some of those clinics and some of those patients may now be presenting as emergencies because we weren't able to properly do what we would like to have, because we had to redeploy our team to assist with what was happening with the COVID situation, and we're still having to do that. So some of the things may be a result of what's happening with the COVID circumstances, and at this particular point in time, as we say, we want to continue to encourage people. We don't want people to be fearful to come to the hospital when they need care. If you need care, certainly we want to be able to provide the best care that's possible, at the hospital, at the clinics, at all levels. But we do know that we have some challenges. Some, I will admit, that we perhaps had before COVID. But certainly with COVID being present, it would add a further strain on our healthcare system.
As we enter the last quarter of the year, we are moving into flu season, which now presents another challenge on top of, having to deal with COVID. But what is the expectation now over the next few months? Should people get flu shots? When should they begin to get them? How do you think now this is going to impact? Because, the flu symptoms are in many instances the same as COVID symptoms. And we're moving now into a period where we're going to see a resurgence in the flu. So how do you anticipate this is going to affect the whole pandemic and even your ability to provide care?
So I actually just spoke about the same thing with some medical students I was teaching last week, because as you say, the symptoms are so similar. So at this point in time, persons with all those symptoms, first rule of thumb is you have to always think COVID and then rule out everything else. We've been promoting early on as well, from some months ago, about flu prevention and the importance of getting the flu vaccine. And we still think that is absolutely important. The World Health Organization also endorses it. It's more important probably now even than before, because we are dealing with COVID, and certainly we don't want to be dealing with COVID pandemic and then worsening of the flu because persons aren't getting the vaccine. Because people do die from the flu. Oftentimes, I think people don't realize it, but we do have deaths from the flu as well. So we don't want people to become too lax. This is the time for you to start thinking about it. Usually the Ministry of Health does a very good job once they get them become available in country to let persons know, because they're usually free at the public clinics, and then other private facilities usually offer them as well. So the time is nearing for you to have that conversation with your physicians about getting the flu shot. We can't stress it enough for you to please. Persons can't have the flu and have COVID. I think that was something that was debated or questioned early on when we saw the first surge, but you can't have both, and I don't think that would be a good combination. I know I wouldn't want to have it, Jerome.
My final question as we prepare to wrap up has to do with vaccinations. There are a number of pharmaceutical companies internationally that have indicated that they could be close to clinical trials for a vaccination. In fact, we could see a vaccination by end of year. I want you to tell us your opinion on all of this. And there is already a fear of what these vaccinations can bring, or what a vaccination can bring. So what's the position on the vaccination? At what point do we know if it's going to be safe?
Rightfully so, as you said, there have always been concerns from the general public related to vaccine safety. And so it's very important as healthcare providers that we have the conversations to make sure that persons understand the importance of why vaccines are needed and, the diseases and conditions that are prevented and even death in some instances. So we think it's very important, certainly when we look at new vaccines. And that is why even when we looked at testing for COVID, for example, we've been talking about antigen testing, but we've been slow to push that as well because we know that you want to make sure that something that you use is at the best standard possible and would have gone through the necessary testing and the vigors of making sure that it is safe to be used. And similarly with vaccines, you want to make sure that it is safe. You want to make sure that the population that has been perhaps used in the research to ensure that it's safe and it's effective, that it's applicable to your own population. Those things are important. And, sometimes we hope that we were able to see proper safety protocols and all of those things are important. And that's why even when, persons were talking about we need to speed up certain things. Yes, we understand it's a pandemic. And yes, all of us would like for the vaccine to become available as soon as it can, but we want to make sure that it's done safely. It goes through all of the appropriate gold standards and reviews before we just start,
Exactly. Yeah.
advising its use, because we don't want adverse effects as much as possible. That won't help either. So, yes, the end of the year would be great, but if it needs to be longer, we need to make sure that it runs its proper course.
And that it is safe whenever it is that we do decide to bring it. Dr. Pinder-Butler, thank you very much for spending the time with us today. Thank you so much. I continue to do the great work that you're doing. We're going to wrap up our show right after this break, but thank you so very much for appearing. I do appreciate it. Thank you.
Thank you again.
Our stories.
To shake up the administration.
Eye on Tropical Storm Dorian.
Our tragedies.
Going on and wipe this place down like that. Get a new national record-setting time.
Our triumphs.
Contest champion Money Hill.
Our culture.
Welcome to Our News, and thank you for joining us.
Our news.
That's going to do it for tonight's show. Just before we go, you would have heard my announcement earlier in the show that I tested positive this week for COVID-19. Approximately 13 days ago, I started not feeling well and decided at that point that I would quarantine myself in my bedroom. And this is where I've been for the past almost 14 days now. And I wanted to just reiterate to folks that it is so important that at any point when you are not feeling well or something is wrong or you suspect that you may have come in contact, that the responsible thing to do is to quarantine. Even if you wait a period of time before you are tested, that way you keep all those around you safe, which thankfully I've been able to do up to this point. Also, it's very important that you stay in tune with your body. If something is not right, reach out to a physician, call the hotline, keep check on yourself. That's very, very important. And so, it was important for me to share that with you tonight. Thank you to all of you up to this point who've been checking on me. I'm doing very well. Happy to say that I'm symptom-free at this point, and hopefully on the way to full recovery. So again, thank you. That's going to do it for tonight's episode of On the Record, The Realities of Living with COVID-19. Special thanks to my guest tonight, Dr.Sabriquet Pinder-Butler. Also special thanks to my production and technical teams for making this show possible, even now remotely. Remember to stay up to date with the latest news and information by watching this network. That's going to do it for On the Record. We'll see you same place, same time next week right here on The Record.